Hello, everyone. Good morning, afternoon, and evening. Dear authors and invited guests, welcome to Technical Session 3D. I'm Pranjal Banage, and this session would be moderated by me. On behalf of Global Knowledge Research Foundation and GR Scholastics, it is my great pleasure to welcome you to the 11th International Congress on Information and Communication Technology, ICICT 2026, in London, UK. The 11th edition of the conference is being organized in a hybrid mode. The physical event was held yesterday in London, UK, and the virtual event is being held through Zoom from 25th to 27th February 2026. I hope you'll enjoy the knowledgeable and interactive sessions throughout the day. In this session, we have 6 presentations. Each presenter will be given 12 minutes for the presentations and 3 minutes for questions and answers. In 10 minutes, I'll raise a gentle reminder. There's another request to all the participants that you all stay connected with us till the closing remarks. If you have any queries or updates, then you can write it to me in the chat box. Now, I would ask our first presenter to come up, who is Hussein Ali Murad, and I would like him to present his paper on data-driven analysis of performance sensitivity and how object size and in-dataset location modulate model object detection evaluation scores. You may please start with your presentation.
Good morning, everyone. Is my voice clear?
Yes, you're audible.
Good morning, everyone. I am Hussein Ali Murad from Informatic Institute for Postgraduate Studies, University of Information Technology and Communication. Our work today, I will present is a data-driven analysis of performance sensitivity of object size and in-data set location modulate model object detection evaluation score supervised by Dr. Ahmed Abdulsahib Hashim, University of Information Technology and Communications. As you know, object detection has rapidly improved through a modern detector like Yellow family. However, a common researcher focus on YOLO or model architecture and treat a splitting of the data as a routine step, and the data structure and object distribution are often overlooked. Most researchers use standard and random splits 17 for training, 20 for validation, and 10 for testing, without checking the properties and characteristics of the datasets and how object sizes are balanced across training and validation and testing sets. This matter a lot in object detection because the object detector is highly sensitive to object scales and could lead to silent bias and misleading and unfair evaluation, especially with the object is small and difficult samples. So, uh, uncontrolled dataset partition can introduce a hidden and silent bias and unstable results. The model may look like strong in evaluation, but yet fail in a real-world scenario. Our key difference, we try to be the first study that focus on precise analysis of training data characteristics and properties before training, not after the training. And treat that analysis as AI system design itself and not just processing routine steps. And we try to correct a common practice that researchers use data and accept it as is and directly start training without examining the data properties and characteristics and its distribution. Our objective is to show how object size splitting uh, procedure can fair and more reliable evaluation than evaluation steps. To do that, we will study two factors. The first one is object size distribution across the splits, training, validation, and testing. And the second one is in data ordering sample location, which means what happened in data when you use it in its original order or when we use it with ordered by size. And to do that, we will use a Coca style size category defined by bounded box. The small object will be 32 by 32 pixels, and the large one will be 69 by 69, and the middle is between those numbers. So the main idea, uncountered dataset partition can introduce a hidden bias and unstable results. So if we control object size distribution across the splits, we can reduce evaluation bias and better estimate model performance. To test this idea, we will use a license plate detection datasets from Kaggle, which contain a 433 annotated labeled image with one main class that reflect real-world conditions. It have a diverse scale and diverse viewpoints resolution of image. And for the detector, we will use IOLO version 11, and we will keep the same training procedure across all experiments to ensure a fair and comparisons. For evaluation metrics, we'll use precision, recall, and F1 score, and main average at the threshold 0.50 and a main average at the threshold 0.50 and 0.95. As you can see here, when we analyze the data, the small objects will represent 30%, and the medium is represented by 58, which is dominate on the data sets, with only a few large objects represented by 11%. And for visual instance, you can see small and medium objects are the most in the datasets with a fewer objects. So the risk here when we use a random split, that 11%, it might miss in test sets or in train sets. So now I will explain the scenario we use to split the data. The first one, as a baseline, we will use unsorted datasets,
Then,
mixed
I'm so
size.
sorry to interrupt, but your PPT is not visible.
Sorry.
Your PPT is not visible.
Sir, your presentation is not visible to us.
Yeah.
Uh,
I'll stop sharing my screen. See if you can present it.
see it now?
Yes, it's visible. You may continue.
I'm sorry for this mistake. Can I go on?
Sure, you may continue.
Okay. We will use a three scenario for data splits. The first one is a baseline. We will use the unsorted data in its original order. In case one, we will take the first 70% for training, and the next 20% for validation, and the last 10 for test. In case two, we will use a vice versa from case one, which will take the first 10% for testing, the next 20% for validation, and the last 10% for training. In scenario two, we will use a sorted data set by size in descending order from large object to small object. In case one, we will use the first largest objects and 70% for training, and the next smallest 20% for validation, and the most small objects 10% for test. In case two, we will use the first largest object 10% for testing, the next smallest 20% for validation, and the last 70% for training. In scenario 3, we'll use a size satisfied discounting with each set sum. First, we will split the data into three categories: large, medium, small, and from each one, we will take the first 70% from training, and the next 20% for validation, the last 10% for testing, and we will collect it in one final set called final train. In case 2, we'll use a vice versa from case 1, which will take the first 10% from each category for testing, the next 20% for validation, and the last 70% for training. Now the key results is here. As you can see, comparing performance in different size-based splitting scenario. In scenario 1, as you can see here, achieve 0.49 and 0.48 for both case, which is relatively stable. But when you use order by size, you can see a drop sharply with both case from scenario 2 achieve 0.12 and 0.21. That is a very large decline caused only by the dataset size ordering and resulting a size bias between training and testing. But in scenario 3, when you use a stratified splitting, the model recover and get better evaluation and achieving 0.36 with both cases and reflect that is more stable from scenario 2. So the main takeaway, data partitioning, especially when size bias exists, can dominate evaluation. Outcomes unsatisfied helps recover and get better estimation for the model and fair and more stable. So to our conclude our results, object size aware partition provide more reliable and fair evaluation than size biased and examined splits, which lead to more model generalization and evaluation fairness. For recommendation, we recommend first analyze the data characteristic carefully and then split the data according to that analysis, and to use a size-aware stratified splitting when evaluating object detection model. For future work, we could use a large data sets with more diverse data
Sorry
sets,
to interrupt you, sir,
and
but I would like you to conclude your presentation. Your 10 minutes
okay,
are up.
okay. We can use a different detector and different extend data partitioning like complexity and density. Thank you for attention. I will happy to take any question.
May I know what was your dataset splitting ratio?
Sorry, I can't hear you.
What was your dataset splitting ratio?
When we use a different scenario, you can see the object size reflecting that the object size could highly sensitive to object detection.
No, sir. I am asking what was your dataset splitting ratio? 80-20, 70-30, 60-40?
Oh, sorry, I can hear you clear. I use 70 and for training, 20 for validation, and 10 for testing.
Okay. Have you checked with other variations as well, like 80%, 20%, or 80%, 10%, and 10%?
No, we use the standard 70 and 20 and 10, but we change the ordering of the dataset. In scenario 1, as you know, we take the first 70% for training. In case 2, we take the last 70% from the data set. In scenario 2, we use ordering by size. So in the first one, we take the largest for the training. In case 2, we take the smallest object for the training, and so on in scenario 3.
Okay, fine. Thank you. Nice presentation.
Thank you, sir. Thank you for attention. Is there any question?
Does anybody have any questions? If not, we can move forward with our session.
Yeah, ma'am. Please move forward.
Yes. So thank you, Hussein, for your insightful and well-presented talk. Now,
Thank you to give me this opportunity. Thank you.
Thank you. Now, I would like to introduce our session chair for this session, Dr. Tanupriya Chaudhary. He is a professor at the University of Petroleum and Energy Studies, UPES, in Dehradun, Uttarakhand, India. With over 15 years of academic and research experience, he has authored numerous publications in high-impact journals and conferences. His research interests include AI/ML applications, specialized algorithms, geoinformatics, AI in healthcare, brain computing, cloud computing, and verifiable computing. I now invite him to kindly deliver the opening remarks.
Thank you, ma'am, for your nice introduction and all. We welcome you all in the 11th International Congress on Information and Communication Technology. And all the best to all the participants. I request all of you to please be online up to the last session will be completed. Thank you, ma'am. Please go ahead.
Thank you so much, sir. Now I would like to invite upon the next presenter, Siddhi Rathi, to present her paper on Comparative Inertial Measurement Unit, IMU, based analysis of gait and postural dynamics in school-age children in foot archetypes using Exen's gait and motion analysis. You may start with your presentation.
Am I audible?
Yes, you are.
Good afternoon to one and all present over here. My paper ID number is 559. My topic name is Comparative Analysis of Gait and Postural Dynamics in School-Age Children with Varying Foot Arches Type using Exen's Variable Sensor Technologies. So, in this presentation, we are going to see all of these things. Introduction. The foot bone form longitudinal and transverse arches with the medial and lateral arch making up the longitudinal arch. So there are mainly three types of foot arches. As we can see in the image, first one is the flat foot, in which there will be decrease in the medial longitudinal arch. The second one is the normal arch, in normal foot, in which the person will have the normal medial longitudinal arch. And the third one is the high arch, in which there will be increase in the medial longitudinal arch. So the flat foot, which is also known as pes planus, is more common in women, individuals with higher BMI and those with larger feet. Flat foot prevalence decreases with age from 54% at age 3 to 11.25% by 18 to 25 years of age. Then the high arch, which is also known as pes cavus, is seen around the prevalence of 7% at the age of 16. Altered arches may lead to gait deviation and postural changes. Understanding these changes help in early identification and the intervention. Variable sensor Exens enables objective gait analysis. Research question. In school-age children, do altered foot arch type, that is flat foot or high arch, compared with normal arches lead to the difference in gait and postural parameters? Rationale of the study is that there is a limited objective comparative evidence using variable motion analysis, and this will also help for the early identification of biomechanical differences, which will help to prevent the further musculoskeletal complications. Objective of the study. The primary objective of the study is to investigate and compare the influence of different foot arch types on gait parameters and postural variables. The study also aimed to identify the biomechanical variation and compensatory patterns associated with each arch type using the variable motion analysis and clinical postural measurements. Methodology. So, after the approval of the IC committee, the we will go to the school where the children will be oriented about the what is flat foot, what is high arches, etc. Then, based on the foot arch type, 186 children will with flat foot, high arch, and normal arches were identified using Indian ink print method or navicular drop test. A goniometer or inclinometer was used to measure postural variables. Extends 3D motion technology was used to measure gait variables such as stance phase, swing phase, etc. IBM statistical package for social science version 21 was used to statistically analyze the quantitative data. Post hoc Turkish analysis of variance was used to compare the study parameters between the groups. Result. So we can see that the speed, step count, and step length will be increased in the flat foot as compared to that of a high arch and normal arch. And we can also see that the high arch will walk more slow, that there will be decrease in the step count. Additionally, those with high arch will have more double stance phase and single support phase as compared to that of normal arch and flat foot. We can also see the postural variables such as there will be increase in the cervical lordosis angle, thoracic kyphosis angle, lumbar lordosis angle, and Q angle, but no variation will be seen in carrying angle. Discussion. Sidek et al. Claim that flat foot causes the tibia and femur to rotate internally. This will causes the pelvis to tilt anteriorly, due to which there will be compensatory mechanism. That is, there will be increase in the lumbar lordotic angle in the people with flat foot. Gill et al. State that the Kimming index and Chipok's Scram index, which both correlate with navicular height, predicted children gait kinematics and gait kinetics. There will be greater CSI and the KI especially predicted lower anterior ground response forces and longer steps. So, according to the Gill et al., the people with flat foot, there will be increase in the step. Rathi et al. Claim that children with flat feet spend more time in the swing phase and less time in the stance phase to compensate for the reduced foot rigidity. Conclusion. The study concludes that foot arch types significantly influence both gait mechanics and postural alignment in school-age children. Children with flat foot and high arch demonstrate measurable biomechanical deviation compared to those with normal arches. This finding highlight the importance of early screening and targeted physiotherapy intervention to improve walking efficiency, reduce the risk of future musculoskeletal problem, and support optimal functional development. These are the references. Thank you for your patience listening. I truly appreciate the opportunity to share this work with you. Thank you.
Ma'am, can you please come to the data set and the data set where you have written 156 people's gate information you have collected? Is it your own data set?
Yes.
Okay. Has it been published anywhere else except this publication? Means how you are validating your informations? That is the only question from my side.
So there was a study which said that the children with flat foot has an impact on the lumbar lordotic angle as well as the steps.
No, I can see. We can also see the method you have applied. It's very good. But I just want to know the data set which you are working or which you have made. Has it been published anywhere else except this paper? Or this is the new one?
This is the new one.
Okay, ma'am. But try to check with doctors as well, so that we can understand or we can validate the same information. We are technocrats, no?
Yes.
That's the main point. That's the ethical
Yes, sir.
perspective of the data. Other way, as per the technical background, it's very good. Thank you, ma'am. We may
Yes,
go ahead with the
thank
next
you.
presentation, and if anyone is having any query, you may ask. It's a good work you have done.
Thank you. Thank you, sir.
Thank you, Siddhi, for your valuable presentation and the knowledge that you have shared with us.
Thank you so much.
Next, I would like to call upon Hiruni Gunatilaka for her paper to present her paper on deep learning based detection of acute coronary syndrome using photoplethysmography waveform images. You may please start with your presentation.
Am I audible to you?
Yes, ma'am, you're audible.
Yeah, okay. Thank you so much. Thank you for joining this presentation on deep learning based detection of acute coronary syndrome using photoplethysmography waveform images. I'm Hiruni Gunatilaka and I'm a PhD researcher from the University of Kelaniya, Sri Lanka. Today, I'm pleased to share one component of my doctoral research, which explores AI-based detection of acute coronary syndrome using photoplethysmography images. As we all know, acute coronary syndrome.
Sorry to interrupt, ma'am, but please, can you share your PPT?
Sorry?
Can you please share your PPT, your presentation?
Yeah, I'm sharing. Yeah, can you see the slides now?
Just a moment.
We can see the slides.
Okay, may I continue?
Okay, yes, please.
Okay. As I mentioned earlier, acute coronary syndrome is one of the leading causes for global mortality. Among the subtypes of acute coronary syndromes, like non-ST elevated myocardial infarction, in short form we call it non-STEMI, it presents a particular diagnostic challenge. Unlike ST elevated myocardial infarction, it may not show clear ST segment elevation on ECG. Biomarkers such as troponin can also take time to rise. Photoplethysmography, or PPG. So it's a simple optical technique used in pulse oximeters and wearable devices. It captures blood volume changes in peripheral circulation. Most of the previous studies relied mainly on manually extracted waveform features. This study introduces an image-based deep learning approach using finger PPG waveform images for automated acute coronary syndrome detection. The objectives of this study include to develop a deep learning model for automated classification of acute coronary syndrome using finger PPG waveform images, and to evaluate model's performance using accuracy, precision, recall, and F1 score, and to compare the performance of custom convolutional neural network model and pre-trained VGG16 model. This slide summarizes the inclusion and exclusion criteria of the study. Before the data collection, the ethical approval was obtained from the Ethics Review Committee of the University of California. Age and gender matched individuals without any previous disease history were selected as the control group. Non-STEMI patients without previous coronary bypass surgery or stent placement were included in the ACS group, acute coronary syndrome group. participants under 18 years of age, pregnant or lactating mothers, severe psychiatric illnesses, cancer conditions, undiagnosed medical conditions, and infections were included from this study. This slide summarizes the key steps involved in this research methodology. Pulse waves were collected from 200 acute coronary syndrome or non-STEMI patients and 200 healthy individuals using the PPG probe, photoplethysmography probe of the multipara patient monitor. Then five single pulse wave cycles were cropped from each participant. Then those cropped pulse wave images were pre-processed using the steps like pre-sizing and rescaling. After that, those 2000 pre-processed images were distributed into 1600 for training, 200 for validation, and 200 for testing. Then those images were input into CNN models, and their performance was evaluated by using the metrics like accuracy, precision, recall, and F1 score. Once trained, these models can be used for predictions. When an unseen PPG image is provided as input, the model classifies it as either normal or with acute coronary syndrome based on their learned waveform features. The data set was split into training, validation, and testing subsets to ensure unbiased model evaluation. So the pulse waves in this each subset were cropped from different individuals. Moving on to the results section, here you can see representative examples of cropped and resized PPG waveform images from both healthy subjects and with patients with acute coronary syndrome. In acute coronary syndrome patients, you can see subtle distortions, reduced amplitude consistency, changes in slope of the waves, and less distinct diacritic notches. But these differences may not be easily quantifiable manually. So deep learning models can detect complex wave patterns within these waveform images. This table presents the performance metrics of the two models developed for acute coronary syndrome detection. As you can see here, both models achieved strong classification accuracy. Among them, VGG16 model demonstrated slightly superior performance. It is likely due to transfer learning benefits from pre-trained image features. These curves show the training and validation performance of the VGG16 model, the best performing model. This demonstrates stable learning with increasing accuracy and decreasing loss over epochs. This decreasing loss indicates that the model's predictions are becoming more accurate over time. This slide links our AI findings to underlying pathophysiology. Actually, acute coronary syndrome affects arterial compliance. Arterial compliance means the ability of blood vessels to distend and increase its volume in response to pressure. The vessel wall loses its elasticity due to conditions like atherosclerosis and ischemic stress. Stress responses causes constriction of the arteries. Autonomic nervous system changes further alter pulse wave morphology. So these alterations influence the peripheral pulse waveform captured by photoplethysmography. Therefore, the AI model is not just detecting random noise. It is identifying morphological changes that reflect underlying coronary pathology. Hence, photoplethysmography is a potential non-invasive biomarker for coronary artery disease. This slide shows why some misclassifications occurred in this study. As you can see here, some healthy subjects, healthy pulse wave were classified as acute coronary syndrome. It may be due to age-related vascular alterations, or may be due to subclinical hypertension or early atherosclerotic changes in them. And some acute coronary syndrome patients were identified as healthy. It may be due to their medication history. One key limitation of this study is that it has not yet achieved full real-time functionality. Although the predictions are generated quickly after pulse waves were input into our models, it requires some offline steps like cropping and pre-processing. So at present, the system should be considered semi-real-time rather than instantaneous. Future work will focus on automating pre-processing. The target state is to run the system on wearable devices like smartwatches or maybe in camera phone lenses. So pulse waves can be detected. Pulse waves can be monitored in real time and provide warnings if abnormal changes occur. In conclusion, both custom convolutional neural network model and VGG pre-trained VGG16 models successfully classified acute coronary syndrome using PPG images, photoplethysmography images. These findings further confirms that acute coronary syndrome alters pulse wave morphology in detectable ways. These models demonstrated robustness with only minor variability-related errors. This approach is a promising non-invasive tool for early detection of acute coronary syndrome. Future studies will be conducted using larger and more diverse populations to improve the accuracy of these models.
But I would now request you to conclude with your paper.
This work was supported by the Research and Publication Division at the University of Kelaniya. These are the references for this presentation. And thank you very much for your attention.
Ma'am, it's a nice work. I just want to know one question. Why you have used CNN over here?
Sorry?
What was the methodology you have used here?
Yeah, we input PPG images into CNN models. Actually, we wanted to do image processing because previous studies relied on manual feature extraction and input into models. But there may be some subtle changes.
Yes, ma'am. I understand your response. Just one query I'm having. CNN is very old approach. Have not you have studied any other approach or any application on any other approach which might be possible? By which may be possible that maybe the accuracy may be improved. Have you checked? That's the only one query I'm having.
Yeah, CNN are specialized in image processing tasks to find, to detect pattern recognition. They are specialized in pattern recognition, image processing. That's why we used CNN in our study.
Okay, ma'am. Thank you. But kindly check if it is possible to add any more hybrid approach along with CNN.
Maybe thank you so much for your valuable comments.
Yeah.
Thank you so much.
Thank you.
Thank you, ma'am, for your insightful and engaging presentation. Next, we would like to move forward with our next presentation of Swapnil Ramteke. I would invite him to present his paper on effect of balance performance and postural stability in youth badminton players, implications for training and injury prevention. You can share your screen and start with your presentation. Okay. Swapnil, you can present your PPT at the end of the session when you have done with your technical problems. Next, I would like to invite Jay Zoglekar to present her paper on impact of corporate communication strategies and spiritual leadership on organizational transformation. You may please share your screen and start with your presentation.
Thank you so much, ma'am. Thank you so much. So the screen is visible, ma'am?
Yes, it's visible. You may start.
Okay. So good afternoon, everyone. Good morning in London, of course. I am Professor Zai Zugurkar, and we are having a research paper today on the domain of corporate communications. Currently, I am pursuing my PhD in leadership, and the main topic is on spiritual intelligence in leadership. We all have been talking about human intelligence since ages, and artificial intelligence is, of course, not unknown to anybody. But human intelligence has always been a very interesting topic where we have only focused yet on the cognitive as well as the emotional intelligence. But I think the third pillar, which is the SQ, which leads to the spiritual intelligence of human holistic intelligence, is not yet so much explored, especially in the West. But in India, it is very much common, as we have already been studied a lot about it. So today my paper is on the domain of corporate communications and how artificial intelligence as well as human intelligence both are having a very good impact on corporate communications. So these are my co-authors, and we three have equal contributions. To just have a short introduction about this research is, as I already mentioned, that spiritual intelligence has not been so much of a research topic, and it's basically a novel field. And artificial intelligence has a lot of scope. It has already been researched a lot, but a blend of integration of both in corporate communications is absolutely has a lot of scope in the future researches. So this paper, this research we have done on a qualitative as well as quantitative basis, and we have primary as well as secondary datas we have used to analyze a few objectives of it. And the basic objectives of this research were, the like first one is um, uh, to know about the role of corporate communication in shaping corporate leadership, and how the psychological aspects of human intelligence will directly depend on both of it. Another of our objective is to study how AI based tools and techniques can help in enabling our communication skills by using many tools, and by using many new practices, strategies, of course, by with the help of AI and as well as human intelligence. The third one objective that we had was to understand in human intelligence specifically how your spiritual intelligence will have a significant impact on your corporate communication skill sets, and also it will have a lot of impact on the conflict management of your organization, and that will lead towards a great leadership. And last but not the least, how both of it can be integrated together, because this is a new field and we need to have good links of it, and we need to establish good integration of both of it. So these are the basic objectives of this research, and we don't have too many of the hypotheses. We only wanted to know the relationship between how artificial intelligence and spiritual intelligence strategies will help in enhancing, if there is a positive relationship or if it does not actually relate to the integration of good skill sets into corporate communications. So the basic methodology that we have focused on is, we have analysis of on the secondary and the primary data both, and the primary data was collected through online as well as through offline. Um, the basic design of our samples was purposive, and it was also snowball because we were looking for some specific samples which work in the front line or maybe have a great work in corporate communication stream. And basically the people who have managerial skill sets as well as they are interacting with more of people, so people centric departments. All of them were corporates, and around 100 respondents had participated. And due to lack of time, we could not have a great pilot study, but definitely we had a good synchronization of all the sample types in our. The secondary resources were from majorly analyzed from the Web of Science and elsewhere data sets. And that data we had, like, it is already validated and it has a good quality of research, so we had considered both of them. Coming up to the data analysis, of course, we had descriptive analysis, we had focused also on the correlation, and we also have ensured about the ethical considerations while we were having this study done, so as to maintain the confidentiality of this research. Talking about the limitations of this research, it may sound like a very different topic and it is absolutely unique, but it is not absolutely limited to the corporate sector. It can also be explored in the future. It can be explored in the academics and in the research more and more because it is novel. But for now, in this research, we have limited it to the national boundaries and only for the academic purpose. So these are the few of the literature reviews which I had mentioned in this thing, but these are not all of them. The basic top five of them, which included the link between how human intelligence as well as artificial intelligence can be blended together, and then how it can be incorporated in our strategy making or the usage of tools like for training for corporate communications and all, how that can be done. Also, how appraisal system and all can be done in case of using AI, and also how they can be trained for spiritual intelligence to be involved in the corporate communications. The basic findings or like the testing results that we had through descriptive analysis was that respondents have perceived that it has high levels of AI as well as spiritual intelligence. We should have to have a corporate effective to have an effective corporate communication, and also it will impact heavily on the leadership communication. In the correlation, we had the results got through our sample size and the correlation analysis, and that majorly spoke about AI integration has to be there to use tools like using AI or automated communication systems. However, they may lack sometimes in the personal and in the touch of customized communication. So that is where the human intelligence should chip in. And of course, AI cannot do the whole work together alone. So that is where human intelligence in communication will help out. So yes, it had a positive correlation. And in the multiple regression analysis also, the results majorly focus that a substantial proportion of variance in the leadership effectiveness will be seen, of course, and it will be like all the variables had a positive impact on corporate communication. So we just concluded with the findings that a positive relationship between the integration of AI and SI in corporate communication can definitely lead towards good leadership in the future. And what we are looking for in the future, like now, it is the age of Gen Zs and Alphas who require a best of the best leaderships. And
I'm
conflict
sorry
management
to interrupt.
also have.
I
Sure.
would request you to conclude your presentation.
Sure, sure. So these are the basic findings that yes, it will have a positive impact, and these were some of the references which I have mentioned in my secondary data which we had included. So thank you so much. If anybody has any questions, I am up for.
No question from my side. Thank you.
Thank you, sir. Thank you.
Thank you, ma'am, for your valuable presentation. Yeah. So next, I would like to call upon Hida to present her paper on sensor-based high impedance fault detection and localization using wireless communication. You may share your screen and start with your presentation. Hello, you're audible.
Yeah, I'll share my screen. My screen is visible?
It was a few minutes ago.
Hello, can you
Yes,
confirm
Christine,
now?
you may start.
So hi, good morning, good afternoon, all. So my name is Hida, and I'm here to present a work sensor-based high impedance fault detection and localization using wireless communication. Me and my co-author Simi P. Wilson is from ABB, located in Bangalore, India, and we are working on power system protection domain. So coming to this work, I will start with what is high impedance fault. A high impedance fault happens when an energized conductor touches a high impedance surface like concrete, sand, or asphalt, etc. So since there is a high impedance surface involved, it will provide a high resistance to the current flow, which makes the current involved in the fault very less. So due to this, it will not cause any damage to the equipments, but when it will become dangerous is that when a human or animal touches the energized conductor, they will get shock hazards, and will be life threatening. And this can also create some arcing due to this high impedance fault, which can lead to the fire hazards. That is also a dangerous condition. So we need to detect this kind of high impedance fault condition and isolate that faulted part from the live conducting parts. So in general, the protection in the power system is done based on conventional overcurrent relays, which depends on the high fault current and operate based on that. But here, since the fault current is low, the conventional overcurrent relays cannot perform or operate or detect the fault, this kind of high impedance faults. So these are the reasons why the high impedance fault is challenging. The one thing is that the fault current behavior, that is the small magnitude of fault current and the random behavior of the fault current waveform and the nonlinear characteristics caused by arcing and presence of harmonics. There are some network interference also will mask the high impedance fault behavior, like harmonics presence and the single phase unbalanced loads also. And another challenge is like lack of field data and lack of a standard model for high impedance fault. Now there are many methods in the literature which are basically mostly depends upon the electrical quantities like current, voltages, or magnetic field, etc. So what they generally do is like they'll extract some particular signature which will be exhibited by the high impedance fault condition and use that for detection of high impedance fault. But what is a limitation coming in general is that this signature can vary based on the high impedance surface involved or the network configuration or the environmental conditions, etc. So and the net interference from the system will also affect it. So it is not it may not work in all the conditions. It will not perform 100%. And there are some other methods which is depending on the artificial intelligence methods, etc. But what is restriction there is like the field less availability of the historical data. So due to this limitation, since the some methods are not performing 100%, we are many utilities like mainly US and UAE are still searching for a high efficient method for high fault detection. And these are the desired attributes for a high impedance fault detection method that should be cost effective, non-intrusive, easy to deploy, and it should work in all the conditions. Now let's come to the proposed method. So a high impedance fault happens when a live conductor break and fall on the high impedance surface or a high impedance object fall on a conductor. Both these causes an abnormal sag in the conductor, and that is what utilized in this method. We are using a sensor to detect the abnormal sag condition, and once the fault information is identified, it will be transferred over wireless communication for protection and monitoring purpose. So this solution is non-intrusive, cost-effective, and surface and environment independent, and it is easy to deploy as well. Now coming to the details of the solution, there will be an OHM or overhead module which consists of a sensor and wireless module placed in the beginning of each of the lines, and when that detects an abnormal condition, it will tag it as a fault, and the information is transmitted over wireless communication to the substation. From the substation, there will be a gateway from where it will be further passed to a dashboard for monitoring and also to a wireless enabled auto recloser for protection purpose. I'll go to the details of each this component in the solution. First, let's see the sensor. So the sensor will detect the change in the conductor orientation or sag during line fall. Different choices of sensor are already available, like tilt sensor or inclination sensor, accelerometer, combined accelerometer, gyroscope unit, or optical or laser-based tilt measurement system. When you go for a practical deployment, we should do a careful trade-off analysis between the cost, performance, and reliability of the sensor selection. For the lab prototype, what we have implemented, we have used tilt sensor bolt type.
Ma'am, sorry to interrupt in between.
Right.
Ma'am, what type of sensors you have used and what are the cost of that? Can you please mention?
Like we have used the bolt type tilt sensor, which was very low cost, like I don't exactly remember the price
That's why
list.
I've asked what is the cost of that and what is this basic specification?
Like cost was very less. I don't exactly remember the numbers, like which was in the hundreds range is what I remember. And the specification is like it is also having some adjustable knob, and it is actually based on the tilt measurement based on a ball. When there is a ball inside this sensor, and when the ball displaces, it will detect the inclination or tilt. So we can also we are also having a threshold for controlling the calibrating the measurement tilt as well. So I don't know where, can I continue? Have I answered your question? Hello.
You may continue.
Yes, please
Okay,
continue.
okay, thank you. So I got the next part is a communication part. So the communication allows the data transmission from fault location to the substation relay. The communication protocol needs to be chosen based on the range, power consumption, and latency. Further, the coverage can be improved using repeaters and antenna for practical deployment if needed. And in the lab prototype, we have used the Wi-Fi technology, and it is implemented in ESP8266 uh, 8266 module, and we have programmed the Node MCU to form a mesh network using the painless mesh net library of Node MCU, and the information is passed shared in JSON format messages. So that is about the communication part. And coming to the OHM consists of a sensor and a communication unit, which will be associated with the mechanical and powering up accessories. When more OHMs are deployed, they can be batch configured from a batch configuration tool. So this allows maintainability and scalability because we have we have maintained the firmware as same identical, and just you can customize it based on the tower location where the OHMs are placed. So during the practical deployment, the power for the OHM, the powering up can be done by harvesting power from the live conductors. The appropriate harvesting technique can be selected based on voltage level, cost, and power requirement. But the clamp-on current transformer is a suitable choice in this. And harvesting energy can also be stored for further usage. And the OHM should be containerized in a mechanism designed for secure clamping, so that you can remove it and install using a tool, something like a hot stick tool. This make the solution more non-intrusive. Now coming to the lab prototype, we have used the OHM is simply a sensor and wireless module, and which is powered using USB connection.
Siddharth, I'm so sorry to interrupt, but I would now request you to conclude.
Sorry, I'll finish it first. So now coming to the dashboard is something like this. It will show the tower's location and the lines on the dashboard map. This is implemented using Python, and the data for this in the practical deployment you can use based on the SLD and the tower location as well. Now coming to the experimental setup consists of 4 towers, which is 3D printed, and the non-conducting materials are used to as the power lines to relay the power lines. And this is the OHM, and the node MCUs are programmed via Arduino IDE, and this is programmed to form a mesh topology. When a fault is detected, the information is broadcasted to the other node MCU modules, and it finally reaches the gateway and trips the auto recloser, and the information is given to the dashboard for visualization as well. So these are the tower location assumed for each tower in our lab setup. So, and coming to the results, we made the first test, we made the line between tower 3 and 4 to fall intentionally. That tripped the auto reclosure, and this is what you can see in the dashboard, and this is the data received in the server of the gateway.
Sorry to interrupt.
Now coming to the
but you have
second
crossed
test.
your 10 minutes limit.
Okay.
Kindly-
I'll conclude.
Yes.
Thank you.
If anybody has any questions, they could please go ahead.
The question already I have asked. I think we can go to the next presenter, please.
Okay. Then I would like to ask Mr. Swapnil Ramteke. Are you present now?
Yeah, I was there earlier also. Thank you for the invite.
Yes. So I would like to invite you to.
Actually, I logged in with 2 IDs, so you allowed to share the screen with the either one, and I was switching on with the other one. So can you please give me a couple of seconds to switch it? Yes.
Yes. Till then, I'll introduce your paper title.
Sure.
Yeah. So Mr. Swapnil Ramteke would be presenting on the paper of effect of balance performance and postural stability in youth badminton players, implications for training and injury prevention. You may now start with your presentation by presenting your screen. I'll stop my screen.
Can you see the screen, please? Hello?
Yes, sir, we can see your screen.
Let me know. Can you see the screen now?
We can see your screen, sir. You may
Good
start.
afternoon, everyone. So I'm going to take up this. Yeah, thank you very much for the opportunity. My presentation is based on the badminton. The title goes Effect of Balance Performance and Postural Stability in Youth Badminton Players, the implications for training and injury prevention, a cross-sectional study. Badminton is a very high intensity and a rapidly direction changing related sports. And due to this intense nature, there are random landings with regards to either double leg or single legs. At times, to initiate and control this fast processes, you require a relatively very strong static as well as a dynamic balance. So badminton is also being characterized with regards to the time bound nature of the game. We have to continuously switch into very rapid directions at a very high intensity. So this requires again a good amount of static as well as dynamic balance to complete the given tasks. So no matches during the set, the player should be able to and change the direction as fast as possible. Due to the movements with a very rapid change in direction as well as fast speeds make them prone to develop a lot of probable injuries across the return to sports related time. The second part, what I'm going to discuss is the young athletes. What I have been focusing in my study population was to be 10 to 17 years of the males and females. They are the one which are developing.
Swapnil, if I am audible to you, your voice is not audible to us. Swapnil, your voice is not audible to us.
So your voice is cracking.
I think this is not getting resolved. So I request you to kindly allocate me a slot because I'm audible, but I'm not able to share. I'm trying it a lot, but it's not possible for me to share the screen perfectly.
Okay, so we'll add you to another session. For
Okay,
now,
ma'am.
yes. For now,
That would be a great help. Thank you.
yes. Thank you so much. So for now, I would sincerely like to thank all of our authors for their excellent presentations and valuable contributions to this session, and all our participants for being a part of this international conference. I hope this session was informative and enriching for everyone. I would now invite our session chair, Dr. Tanupriya Chaudhary, to deliver the closing remarks and conclude the session.
Thank you very much, ma'am. I think all the presentations have been done successfully. Only one presentation was having some issue. I kindly request him to please record a PPT and voice by using voice note and please send to the organizer. Otherwise, Springer may reject your submission.
Sure, sir. I will do the needful.
Yeah, thank you. And
Thank you
thank
very
you
much.
very much to all of the participants for joining here. And very soon, you will be receiving an email from the organizing partners for publication and all. Thank you, all of you. And we may take one photograph, I think. If anyone is interested, please switch on their camera.
Yes, I would ask everyone to switch on their cameras.
And also, I am sharing my details and my mail ID. If anyone is interested, may please drop an email for further collaboration. Thank you.
Thank you, sir. Appreciate your energetic responses and your inputs. They were really valuable. I would like everybody to turn on their cameras so we can take a snapshot.
Sir, beats cake cookies.
Okay. So I'll take the snapshot now. Everybody smile.
Thank you.
Thank you so much, everyone.
Thank you very much.
Thank you.
Thank you.
I will ask everybody to wait. In the end, I would like to present this as a token of appreciation for our session chair on behalf of Team ICICT 2026 and Global Knowledge Research Foundation and partners. Thank you so much, sir.
Thank you, Pranjal. Thank you very much.
Yes. And all the presenters will receive their digital certificates via email within 2 working days. The publication will be live within 7 to 8 months. Kindly cooperate with the ICICT team 2026 team. On behalf of the entire team, thank you for your continued support. through the 11th edition and all the previous editions. We look forward to welcoming you again for the 12th edition in 2027.
Thank you, ma'am.
Thank you, everybody, for your valuable presence. You may now leave the meeting.
Thank you for everyone. Thank you.
Excuse me, Pranjal ma'am.
Yes, ma'am. Yes, sir.
Yeah, I just wanted to just know one more time. Now also when I was trying to open up my camera, it was showing that the host has stopped the camera. I was not able to open up my camera as well. So likewise, the screen also was not able to be shared, I
So
believe.
even if your camera is stopped, you do have the access to share your screen.
No, just now when you asked to everybody,
Yes.
open up and switch on your cameras, by that time also, my camera was also not going to be like opened up. Neither my screen was able to be shared.
Then, sir, I think it's a technical difficulty because those are not one of the restrictions that we have put on the participants.
Okay, so as sir has conveyed me, I need to go for a recorded presentation and submit it over the mail to the which email address?
So that I don't have the knowledge about.
Hello, sir. It's Iris support@icict.co.uk.
Please, can you hold for a while? I'll write it down.
I'll just mention you in a chat box. You can just share your recorded presentation on this email ID.
And that requires the camera on?
Yes.
Fine.
It's required.
Thank you, ma'am. Thank you.
Okay.
That would be of a great help. Thank you much.
Thank you, sir.
Thank you, everybody. Thank you, all of the participants, the authors, the session chair. Thank you.